Pam and Sophia are settlers on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Their families immigrated from Hong Kong decades ago. Pam speaks English, Sophia speaks Cantonese. This is their story. Pam is a retired teacher in Merritt and moved back to Vancouver to care for her mother, who has since passed.
I retired early in order to be my mother's caregiver because she was living by herself and because of her mobility issues.
Pam was bereaved. It's never easy losing someone, even if they were in the best health. Pam wants joy and a new purpose. She wants to connect with people who are like-minded and engage in mutual exchanges. Sophia had been busy working and caregiving. She never used the community center nearby and didn't think it was for her. She also developed muscle pain. She was admitted to the hospital about 10 years ago. After her discharge, she was referred by the hospital to a Cantonese community older adult rehabilitation and wellness program under VCH Community and Home Health. So Sophia stayed shut in her often empty house, except when she'd go for rehab. She kept going to rehab, but never once stopped by the community center and the park where others practiced Tai Chi, until her occupational therapist told her to stop coming to rehab because it had been 10 years since she joined the rehab program and the wait list was growing.
有嗰啲 supervisor 咧就話你已經差唔多10年啦嚟咗，你要畢業咁啊嘛，叫我我畢業叫我去福康路，來得來Lily 嗰度咧都會帶我哋去福康路參加佢啲好似過年啦或者乜嘢有舞獅集埋一齊咧都會帶我哋去佢嗰度嘅。
What if doctors had a way to nudge Sophia to participate in Tai Chi or other groups happening at the parks and community centers? Would the rehab waitlist shorten? Might Sophia meet a friend in the neighborhood? What do we need to enhance service access for Sophia and Pam?
我都冇諗住轉唔轉嘅，不過我嗰個大仔話我成日咧話。
As early as year 0, Pam and Sophia could have learned about the community activities through respite and rehab services or pharmacies. Thankfully, Pam learned about them at the library during respite while Mom was still around. Great community activities need to be consistently funded and known to the health sector. A closed-loop digital solution can help health and community staff work together. That way, Pam and Sophia would have found the community activities earlier, and perhaps a neighborhood friend through the years for herself and Mom.
I was looking for activities for Mom to do. There was a notice at the Hastings Library in regard to free activities at Fog Hollow Neighborhood House. Arrangement was made for 2 seniors programmers to make a home visit. They spoke to Mom in Cantonese and explained to her all the free programs that were available.
好多樣嘅，有瑜伽啦，有拍手掌啦，太極，學下英文嗰個 iPad，嗰啲英文咪即係對我嚟講咪好啲咯。
Mom was not open. However, I found free activities for myself. Activities like caregivers get-together, Tai Chi, and art in the park. All these activities help me to meet new people, to make new friends, and to de-stress. I found it stressful being a caregiver. It was so much easier to teach.
We can move upstream and harness the preventative potential of a strong community sector with healthcare linkages. Connect with a community center, neighborhood house, or senior center, or write in to your municipality. Share the digital solutions with your family clinic, pharmacy, or community health center. Try a social prescription today.